And please feel free to visit us at sagesirona.com to check out our first aid kits, but you can also check out all of the educational material I have up there to empower you to have better health. Okay, so those are my top 4 strategies for getting rid of heartburn, stomach aches, or reflux. Now, if you decide to take any of these products, you really do need to research any interactions with your medications and other side effects. Just because we're talking about herbal and naturopathic medicine doesn't mean that these things don't interact with other things, and it doesn't mean that they don't have side effects. So do your duty and please do that. So my final question is, do you have favorite interventions that you use when you get a stomach ache or heartburn? I'd love to know about them. Number 4 is a toe to heel drop, which I'm going to show you how to do. But oftentimes heartburn or reflux or stomach aches can be caused by a hiatal hernia. And a hiatal hernia is when your stomach pokes up through your diaphragm and it causes issues because it's herniating through your diaphragm, which it shouldn't do. Now, so sometimes I will advise patients to do this. First of all, drink a full glass of water. Pretend I'm drinking water. 8 to 16 ounces is usually what I tell people. You stand up and you can't really see, but you're gonna rise up on your toes and drop down on your heels. Rise up on the toes, thump down on the heels, rise up on the toes for a 3rd time and thump down on your heels. Now, the weight of the water in the stomach, what that's going to do when you thump down on your heels is it's going to use gravity to reduce that hernia or pull it back through your diaphragm back into its normal position. If you need to and you want to try this and you don't have very good balance, hold on to something for that drop so you don't fall down. You don't want to hurt yourself with a fall while you're trying to help your heartburn. Number 3 is acid reflux, also known as acid assist, and it's a product by Mountain Peak Nutritionals that's in capsule form. Generally with GI conditions, including like heartburn, reflux, or stomach pain, I prefer to give powders or chewable tablets or teas because I like for the intervention that I'm giving to actually touch the tissue that it's treating. One of the exceptions to this, though, is acid reflux by Mountain Peak Nutritionals because it works so fantastically well to alleviate heartburn and reflux and stomach pain. Now, we do have acid assist or acid reflux, they're undergoing a name change right now, in our home and office kits as one of the tools that we offer to help your entire GI tract. Number 2 is ginger. Now, ginger is a great anti-nausea herb, and for some people it does work for their heartburn. Some folks do find ginger too warming for their heartburn, so if you decide to try ginger for your heartburn, keep in mind that it might be an herb that makes things too warm in there. Ginger is also an anti-spasmodic herb, so for some folks it can work to alleviate stomach cramps too, which is nice. Now at Sage Sirona, we do offer ginger in various forms in our home and office kit, in our auto kit, and in our kids kit that we're developing right now. So here are my go-tos for heartburn and stomach ache. Number 1 is DGL, and DGL stands for deglycyrrhizinated licorice, and now you know why we call it DGL. DGL enhances mucus production in the stomach, and what that mucus does is it creates a barrier that protects the stomach and the esophagus. So this barrier also allows the sensitive tissue in that area to start to heal because acid isn't touching it with that DGL on board. DGL can also offer some protection against the stomach damage that NSAID drugs like ibuprofen and naproxen can cause. If you are consistently getting stomach aches or heartburn, you need to contact your doctor and have a visit with them. It's not normal to live in a state of constant heartburn or reflux or having stomach aches all the time. And taking an acid blocking medication long term comes with a whole host of side effects that you're going to want to avoid. And that just goes back to seeking root cause medicine is always the way to go, because really those acid blockers are just a band-aid for something else deeper that's going on. If you want to truly get healthy, seek the root cause. Hi, I'm Amber Belt, naturopathic physician, and I'm here today to talk to you about my 4 favorite strategies to beat heartburn or a stomachache. Now first, I am a doctor, but I'm not necessarily your doctor, so you should not take anything in this video as medical advice.